wanted to do a quick video today about some of the must-haves for a new baby. This one specifically is about like sort of medical, like medicine cabinet sort of stuff. So here we go. Okay, so one of the most important things to have when you bring your newborn home is a thermometer. Especially when babies are really young, it is important to know if they have a fever because they need attention very quickly. If they do get a fever, just to prevent dehydration, their body's so small that it can be easy for them to dehydrate. So having a good thermometer on hand, even the like touch forehead ones are really important. And I'll put links to all the stuff I talk about in my description if you guys want to check out the ones that I have used and like. The next thing is a nose sucker. So like one of those Frida nose suckers is really important because sometimes babies will get, you know, some snot or whatever, and their airways are so small that even a little bit of snot can really make a big difference. It might make the baby cry when you suck the snot out of their nose because it's not always pleasant, but it can really help if your kid has any sort of congestion going on when they're little. So I tend to be pretty like crunchy. I don't use a lot of drugs, or I try not to use like artificial stuff with my kid as much as I can. You know, there's a time and a place to use things like tylenol, ibuprofen, things like that, but I try and stay away from those things just generally as much as I can. So one of the things that I really like is arnica. It is a pain reliever and an anti-inflammatory, so it can help with things like teething, bruising, etc. So I'll put a link to one that's okay for kids 6 months and older. And then just, you know, make sure to ask your doctor if you have any questions about any of this. I'm not a doctor. This isn't medical advice, but these arnica tablets have really helped me and my kid during various bouts of teething and things like that. Another one of my favorite supplements is these camilia drops. They are basically like really strongly brewed chamomile tea that's put in these little droppers. Until baby is like, I think it's over 2 months old or over 6 months old or something like that, you're not supposed to give them anything other than like breast milk or formula, depending on how you're feeding them, because it can mess up their balance of electrolytes. So you're not supposed to just like give the baby a bottle of like water or chamomile tea or whatever, because it can mess with the electrolytes in their system. So these camilia drops, they're okay for babies 2 months and older. And they're just really gentle. They're really easy to administer. My kid really likes the taste of them. And so it's a way to get them some of that like calming chamomile tea effect without having to like brew chamomile tea for them, which you often can't even give to babies that are super young. So the next thing is a good diaper cream. I like Bordeaux's. One tip that I learned from a mommy board when I was pregnant was that if you put diaper cream on the kid, even if they don't have a diaper rash, before you go to bed, then like they can wet the diaper overnight, and like as long as it's not leaking, or like, you know, if it's a really dirty diaper, obviously it should be changed. But if you do a thick layer of butt cream before you go to sleep, then you can often make it all the way to the next morning before you actually need to change that diaper. In my experience, that only works with disposable diapers, not with cloth diapers. So you have to see what works for your family, but that tip has saved me lots and lots of hours of sleep. The next thing, I didn't have a humidifier, even though it was on all these baby lists of things that you should buy before you have your baby. I don't know that I necessarily say like every parent needs to have one, but we did end up buying one when my kid was a couple months old. He got some congestion and had a little bit of a cough, and it really helps to like soothe the airways when the baby sleeps if you have a humidifier in their bedroom. So that is something, even when we travel, if he gets sick, I'll go buy a humidifier at the drugstore in order to use it while we travel. For me and my family, it makes a huge difference. I don't put any of like the medication or the menthol or anything like that in it. I just do, you know, distilled water or whatever the label says to do, and just make sure that the air around the baby stays moist. They do get hot, so you have to make sure they aren't anywhere where the kid can like pull them down, obviously. Another thing that's nice to have is probiotics. They're, you know, they're born and their guts are so small, like their intestines and everything, and they experience quite a bit of intestinal discomfort when they're newborns, and everything is, you know, just getting started and all of that. So check with your doctor, obviously, before you like give your kid anything weird, but I use probiotics with my kid and he seems to do really well with them. I'll drop a link of one below that says that it's safe for newborns, and I've used it and we really like it. And then the last thing I would say is actually to have some sort of a fever reducer. I rarely use fever reducers with my kid because I tend to think that a fever, you know, it is the natural body response because it is actually effective for getting rid of whatever, you know, virus or bacteria that your kid is fighting off. So I don't like to stop that natural process. However, if it's late at night and you've got a kid and they spike a high fever and you're concerned about it, it is important to be able to like get their fever down quickly if it gets to a dangerous level. So for me, myself, I use ibuprofen for that. If the kid's under 2, you actually have to check with your doctor to find out like what the appropriate dosage would be. So I would say if you are going to a wellness visit, just ask your doctor like, hey, if my kid spikes a fever, at what degrees should I give a fever reducer? And it doesn't say on the box how much to give them, so how much should I give them in that case? And your doctor will tell you based on, you know, weight and months old and all of that, what you would do. So that's important because, you know, if you wake up and it's 2, 3, 4 a.m., you don't want to have to make an emergency call to your doctor, and you don't want to have to like rush out to the drugstore to go get something while your kid's like having a fever. So I myself like ibuprofen. I've done some research. You can search like the effects of Tylenol on children, and Tylenol is not my favorite. You know, different people like different things, so whatever works for your family works, but for myself, I believe that ibuprofen has less likelihood of side effects. That's just my 2 cents. So again, just to recap those items, we've got a thermometer, particularly one that you can just like put against the kid's head, a nose sucker like the Frida nose suckers, or even just one of those bulb nose suckers, arnica for pain relief or anti-inflammatory, camilia drops for calming the baby and helping with fussiness or colic, some sort of a diaper cream, a humidifier in case your kid is congested, as well as some probiotics, and whatever your family's fever reducer of choice is, ibuprofen, Tylenol, etc. Okay, thanks guys for watching. I hope that you felt like this video was helpful. I love talking to you guys. And if you like this video, go ahead and hit the like button. And if you'd like to see more of these videos, tips, hacks, etc., go ahead and push the subscribe button. And I'll talk to you guys next time. Okay, thanks. Bye.
Thanks guys for watching, and please subscribe and check out the links in my description.